everybody. This is Ben,
And I'm Taryn.
and welcome to this episode of Walking Between Shadows. This is going to be a little bit different because we have some subject matter we have to discuss.
We need to discuss it.
Yeah, it's hitting home.
Yeah.
Yeah. Ozempic.
Ozempic.
Weight loss. So, you know, so I don't truly understand what has been going on with this. You started talking to me about this a couple months ago when a friend of yours got on Ozempic for weight loss.
So my best friend, who I also she considers me her therapist. Don't you think so?
Yeah.
So I get phone calls, every morning, and they're
Mhm.
normal,
Mhm.
and normally she's a pretty happy-go-lucky, chill girl,
Mhm.
you know, or
Mhm.
why else would I hang out with her? But
Well.
so a couple months back, I get this phone call.
Mhm.
And, we're just talking, and she's like, "Well, I gotta go. I've got to go get my shot." And I'm like, "Shot? What the hell kind of shot are you getting?"
Mhm.
Because she knows me, and you know me, and I don't go to the doctor unless it's like I have to.
Yeah.
And if I could find an old swamp witch out in the woods, I would absolutely beg her to be my holistic herbalist medicine woman. But I can't find her yet. I'm
Would she
still
cover
looking.
you in mud and moss and shit like that?
As long as she's not pumping me through full of like pills and stuff,
Yeah, yeah.
we're good.
Okay. All
My
right.
experience with doctors is not good.
Mhm.
So she tells me she's going to get this shot for weight loss.
Mhm.
Okay, first of all, her ass ain't even that big at all. She's
Mhm.
not big.
Right.
Definitely not big enough to be on something that you inject into your body
She's not morbidly obese.
at all.
No.
And what she tells me is, well, you have to have a BMI of over 30. Okay.
Uh-huh.
And I said, well, what the hell's yours? 31. Oh, okay then. What
She'd be ordering at Marco's Pizza to get that BMI up.
it's very convenient, if you ask
Mhm.
me.
Mhm.
And I've seen her go, just seen her hop on these trains with these
Mhm.
doctors over the past couple of years. I mean, hormone replacements in her ass. I mean, you name it. She'll sign her up.
Uh-huh. Uh-huh.
But I don't think she did the research.
Has she ever had Botox?
No, I don't. She hasn't had Botox, but
Hey,
don't.
if you're listening, try Botox.
So she gets on this shot,
Mhm.
and I'm telling her the whole time, why the hell are you doing this? Don't do this. Oh, and she's going about her days, and she didn't do her research on this. What
Uh-huh.
I mean, she just jumped right on in.
Yeah, doctor said you need to lose weight. You want to lose weight? I got a way for you to lose
I
weight.
got this magic
Yeah.
right here in this needle.
Uh-huh.
So I'm watching her over the weeks, and I'm researching it, and I'm watching. There's a girl on YouTube that has a podcast, Jamie French, and she did a review on the Ozempic and what she went through while she was on it.
Yeah.
So I'm telling my friend this, hey, go watch Jamie French on YouTube.
Mhm.
She's got a lot of followers, and she might tell you, like, oh no, it's not the Ozempic. I just can't eat nothing. And I just feel.
All right. Well, let's talk about that for a second. Let's talk about these crazy side
Let's
effects.
do that.
So, if you just look it up, the side effects of Ozempic, more commonly, this is a long list:
Okay, here we go.
anxiety, bloating, blurred vision, chills, cold sweats, confusion, constipation, cool, pale skin. Two of my favorites.
Nice.
Um, cough, darkened urine, depression, diarrhea, difficulty swallowing, dizziness, fast heartbeat, fever, headache, increased hunger, indigestion, large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, and or sex organs. Yuck. Ugh. Loss of appetite, nausea, nervousness, nightmare, pain in the stomach side or abdomen, possibly radiating to the back. Another fun one: seizures, skin rash, slurred speech, tightness in the chest, trouble breathing, unusual tiredness or weakness, vomiting, yellow skin or eyes.
Mm.
Now, that's just the more common side effect.
How is jaundice like common side effect?
Yeah, something's really got to be wrong there. Yuck.
Okay, it's all right that I'm completely yellow all of a sudden. It's just one of those common side effects that go along with it.
So here are the ones they list that don't necessarily need medical attention and they're less common,
Okay.
but gross nonetheless.
Okay.
Acid or sour stomach,
Sweet.
belching,
Nice.
excess air or gas in the stomach,
Mm.
feeling pressure in the stomach, heartburn, flatulence, farting,
Mm.
stomach discomfort, swelling, tenderness, or upset.
Yeah.
So we've gotten through the bulk of the list, but then they go on to say things like, well, uh, very common in gastrointestinal issues are nausea, increased amylase, increased lipase, diarrhea, vomiting, constipation, abdominal pain, dyspepsia, flatulence, gastroesophageal reflux disease or GERD,
Hmm.
abdominal distension. So you're going to have a big belly and you're
Oh,
trying to lose weight.
oh, barrel belly.
Yeah, barrel belly, and you're not going to tell. Gastritis or gastroenteritis, appendicitis, pancreatitis, chronic pancreatitis, acute and necrotizing pancreatitis.
A lot of tituses.
A lot of tituses that'll kill your ass
Yeah.
when you least expect it.
Right.
Hypersensitivity. So probably the more rare is anaphylactic reactions.
Yeah.
Angioedema,
No, what's that?
an anaphylactic reaction.
Yes. Do you know what that is?
It's kind of like an infection,
Okay.
but I can tell you anaphylaxis is a life-threatening allergic reaction. So
Okay.
that's what I mean. It's more of an allergic reaction.
You know what?
And it needs immediate treatment.
So far,
Uh-huh.
having some ass sounds a hell of a lot better than this right here.
For real. Put the booty up there. Hush. It can mess with your eyes. Diabetic retinopathy complications. Oh my God.
Just
So
on and on and on.
yeah, metabolic is hypoglycemia,
Hair
decreased
loss.
appetite, hair loss,
Yeah.
immunologic. There's some issues that go on with that. Uh, there's some hepatic reactions. You can have acute gallbladder disease.
Mm-hmm.
Um, very common is fatigue. Most people
Yeah.
experience fatigue taking this.
Now I've noticed that.
Headache.
You think about it. I mean, like, okay, so you no longer can consume sugar, right?
Uh-huh.
I mean, because you're basically on you're basically in keto at this point, right?
I think so. I think that's how it works. Yeah.
And then like some other people that I've spoken to that have
Yeah.
had medical cards that have told me that when they got on Ozempic, they were unable to feel the effects of the cannabis anymore.
Oh.
And uh, doing this research, I found out that, um, serotonin is produced in our gut.
Mm-hmm.
And that's exactly what Ozempic destroys.
Mm-hmm.
So and serotonin is a hormone that we produce in our gut, 95% of it anyway,
Mm-hmm.
that, it helps us feel happy.
Yeah.
It's the happy hormone.
Yeah.
So you think about it, like you immediately cut out sugar and you immediately cut out any, say cannabis. So, there's several different things that's used for. And I don't know what else it may, you know, completely wipe out, but those
Well,
two things right there.
the whole design of the drug is to stop your body from digesting food as quickly as normal.
This doesn't even sound safe.
No, and we all know, like, well, not we all know, but when you start doing things like that, you destroy the microflora of your gut,
Right.
and your immune system starts and ends really in your gut. I'm sorry, but that
Sure.
microflora in there produces hormones that are necessary for your bodily functions, and not just for your bodily functions, but the functions of other microflora. Did you know, Taryn, that 25% of our body weight, our mass, is DNA other than human?
What the hell is it?
It's those microflora, it's those bugs that live in your gut that help you digest food.
Okay.
And
Know that.
so as much as but it's not just that, they're on the surface of our skin, they're in our body, through our body, on our body. And that's right, 25% of our mass is made up of those genetics. That's how much we are dependent upon
Right.
organisms that we can't even see to keep us safe and healthy. If we didn't have those, we wouldn't survive.
And over the years, I mean, we've changed our habits with
Uh-huh.
the way we bathe and shower so many times a day. And
Yep.
I mean, we feel like we have to. I mean, I know I do.
Yeah.
And that's probably not good either. I mean, or I guess it is, but in a way,
No,
does it remove?
so when I was out west working at a very prestigious university,
Hmm.
we got involved with a study about the effects of our practices of hygiene. And to keep a long story short, because there were so many things that were studied in that, we basically kill off most of our protective biome.
Hmm.
So we have a gut microflora or a microbiome that exists and it has to be harmonious to us.
Hmm.
If it gets out of control, it can make us sick.
Right.
And so drugs like this interact with that. They interact with the very key to our health in order to help us change something.
Hmm.
And then once we've done that, we have to build back through that.
Right.
And nature's always going to have its way.
Sure.
And that's what bothers me about this. These drugs are developed for people with, type 2 diabetes
Yes.
and needed that sort of physiological help.
Hmm.
And one of the side effects was weight loss. Well, now some diabetics can't even get access to the drug because it's all being used as weight loss
And
drugs.
boy, they're making some money off this.
Oh, they are.
I mean, I would consider what my friend did and a couple other people I talked to, not everyone, cosmetic.
Hmm.
I would consider that to be cosmetic. Um, I've also found that several people, as soon as they got off the Ozempic, put the weight right back on.
Yeah.
So that's another thing.
Yeah.
But now we're going through this journey with my friend and we're going through the weeks, and she has approximately been on it for, it would have been 2 months today.
Hmm.
And we get up to the last 2 weeks. Okay. And I've done my research on that. I've been looking into this and I'm telling her, look into this.
Hmm.
No, 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 no. The first phase I say is the Ozempic denial. It's not the Ozempic. And then we go into despair.
Right.
Ozempic despair. And it has been a roller coaster of emotions for her, bless her heart, and mine as well, and her daughters. So we've been trying to get her through this the
It has
last 2
truly affected everybody around her.
Oh, look, we're sitting there saying, and this is a totally different issue. We're trying to pump her up. You're better than this. You can do better. And she's over there puking while we're on the phone FaceTime with her.
Uh-uh. See, I didn't know all that was going on. So,
And we're both like, her daughter and I are like, you can do this. You've got this. And she's over there, and we look up, and where are you? And I hear, "Bleh,"
oh Lord, poor
So
thing.
I know it's been horrible, and we'll just be talking, and she'll just start crying, like out of nowhere, and it's
Yeah.
pitiful. And
Well, I mean, when you start messing with your body chemistry, it takes you on this roller coaster ride.
I'm like, darling, you remember, you know, you've cut out you've cut out some things, sugar, you've cut out a lot of things that your body was used to, you know,
Yeah.
everyday life, and
Yeah.
it's changed. And now it's how do I get this shit out of my system?
Yeah.
And that's another topic because I feel like, what I've read, it seems like it takes about 5 weeks after your last injection
Ugh.
to completely
God.
get out of your system. And I found out that, a friend of mine from Colorado, she got on it. I don't know why she was ever on it because she's not big as anything,
Mm-hmm.
but she was on it for 3 months.
Mm-hmm.
And she said it was the most horrific 3 months of her life. At first, she denied that it was the Ozempic that was making her feel this way.
Mm-hmm.
And then she realized, it was the same thing, Ozempic despair. But um, she has since developed a thyroid condition to where she has to take thyroid medicine every day
My
for the rest of
God.
her life. Another lady that I spoke with, she shared her journey with Ozempic, and it was horrifying. I
Yeah.
mean, it has led to, she said she went through it, and the doctors didn't really tell her much. She's a nurse, and she lost, a little weight. She lost some weight,
Mhm.
or none. I'm sorry, she didn't lose any till after she got off of it. And since then, she has, experienced heart palpitations, and she is diabetic now, type 2 diabetic now, where she wasn't before. And she has developed a chronic disease that she'll never be able to get rid of for the rest of her life. She can no longer drink alcohol or take caffeine. I mean, no sugar. It has, she said, ruined her life.
Yeah.
And she's had a hard time getting doctors to believe her.
Yeah.
She even went to the cardiologist, and he tells her that she needs to go into a mental institution. Right. Which, you know what? You jerk. Really. I just don't know that they tell people. So I have another friend that she was not diabetic before. She got on Ozempic. She
Mhm.
tried it out she was supposed to be on it for 3 months. She only did it for a month.
Mhm.
Developed type 2 diabetes. And during that time experienced,
As a result of taking it, she developed type
yes,
2?
yes.
Okay.
So that was the second person I found out that
Yeah.
got that. And then I spoke to some people that, um, 3 people that have loved it.
Yeah, had good success with it, lost weight,
No issues.
no side effect problems.
None.
But I still feel like the majority of people are having trouble,
Yeah. Yeah.
don't you?
Like I said, I put this out there yesterday,
Mhm.
a couple TikToks and reels, and the feedback I've gotten on it is not 50-50. I would say it's 60-40
Yeah.
so far. Yeah.
Yeah.
60 leaning towards it's horrifying. And
You got the shits, the pukes, the farts, the depressions, the crybaby, got it all.
just yeah, I mean, yeah.
Mm.
And then, the other half that say, "Look," and then you see these celebrities that are on it
Yeah.
that are, they claim it's a huge success. I watched Sharon Osbourne, and she looks different.
Yeah.
So does Kelly Osbourne, but they both, claim that this has been a miracle drug, that the first couple weeks was rough
Yeah.
on their stomach, but after that, no issues whatsoever.
Right. Right.
So, yeah.
I wish they'd get on and like tell that, like what the true story of what they endured through using it.
Right,
I,
and
I guess it's a springboard though. Like if you need to trim a little weight off and keep it off, I guess it could be a springboard. But most people are just lazy as hell. They just want an easy way to lose weight, and then when they have to stop it, it comes back.
yeah,
Yeah,
yeah, I mean,
all the symptoms that it treats are now back.
and you remember the craze back in was it the 90s? Was it Fin?
Fin fan.
Yeah, at least that was fun.
Oh yeah, I mean,
I
there's
mean,
crackhead symptoms with
might
that
blow your
shit.
heart out, but
Uh huh.
you're awake.
I used to take that shit and go work out
Yeah,
with
well,
the garbage bags on and shit. I mean, I was trying to kill myself.
yeah, you're young.
Stupid.
And then you listen to these, and that's what I hope people, I don't know, I hope people research this. And
Mm-hmm.
because there's this one lady that I've spoke to that's gone through all these issues, cannot get a doctor to believe her. Got one finally,
Mm-hmm.
and the one that she finally found told her that she's had some people lose their lives
Mm-hmm. As a result of
as a
taking
result of
Ozempic.
Ozempic. And that, just beware that not always do our doctors or nurse practitioners have our best interest in mind.
Now, if I'm not mistaken, some compounding pharmacies actually make this stuff.
Really.
Yeah.
Yeah.
So, um, yeah, we have friends in that business too.
Oh,
You
yeah.
worked in that business.
Sure.
Yeah, it's scary
Yeah.
what's going on out
Yeah.
there.
And I wonder, I wonder, I know that that pharmacists, like when I worked at a pharmacy, I worked for a great pharmacist that he always informed, everyone.
Mhm.
And you get those pieces of paper that, tells you all the side effects, but do we read those? And a lot of times, do we listen? Do we take heed
No,
to the side effects? That's just rare.
no, I ain't gonna happen to me.
But when I did this, when I started researching this Ozempic and talking to people, it's not so rare. These
Yeah.
side effects are not so rare. Like I said, 60/40.
Mhm.
That's 60 being, having some major side effects.
Mhm. I bet it's more than that. People just won't admit to it.
Right. And they might be in the first phase of Ozempic denial.
True.
I don't know. I hope that everyone that tries it has a successful journey. I don't think that more than half need it. I mean, I think that three-fourths of the people that are on it do
Mhm.
not need it.
Now I understand that the diabetics that actually need it, that it works for,
Hmm.
um, some can't get it because of this weight loss craze.
Right. And it's money.
Yeah.
And we have to remember that doctors get kickbacks on these new medications.
Yeah.
And maybe it's not brand new, but it's word for diabetics.
Mhm.
And I've heard doctors, I've researching this, say that this is specifically used for people that are getting ready to have gastric bypass surgery.
Mhm.
So they'll give this medication to patients that are about a month or two out from gastric bypass surgery to shed those major few last pounds that they need
Mhm.
to lose before they have this surgery that saves their lives.
Yeah.
So there's a difference when you have to do something to save your life
Yeah.
over, you know,
Yeah. It's
losing a few
crazy.
pounds. Yeah.
Mhm.
Yeah.
That's our society for you, though.
Yes, it is.
Mm. All right. So, everybody out there, if you have comments or you know something different than what we're telling or what our experience is, please leave a comment. Let us know, what you think and what your experience is. I'm kind of thinking this may be something we revisit at
Yeah.
some point.
Yeah.
But again, we appreciate everybody watching. Don't forget to hit that like and subscribe button. Click that notifications bell so you can see new content as we launch it. And we appreciate you attending and watching our videos.
Yeah.
So we'll see you soon again. We're going to start really putting some content out there for the spring and summer, and we're excited about that. Thank you all. We'll see you again on the next one.
Bye.